Welcome back to Women Health Hour, where we dive into important conversations that matter today. Today, we have a very special guest, Dr. Zara Hashmi, a highly respected gynecologist with major experience from women's health to reproductive care. Dr. Hashmi has been helping countless patients navigate their health journeys and with expertise, compassion. In this episode, we will be discussing the topics like pregnancy care, menstrual health, fertility, and busting common myths and getting expert advice straight from our source. So whether you are looking for answer about your own health or just curious about women wellness, the episode is packed with valuable insight. Let's welcome Dr. Zara Hashmi.
Hi, I'm Dr. Zara Hashmi. I am a gynecologist. I have been working in this field from past 15 years. I visit multiple hospitals and I have my own specialized clinics where I deal with women health, and we also spread awareness among in women in lower socioeconomic status, so that we can help them in any way in regarding their health.
So I would like to ask you some questions regarding women health. Like, what are some common myths about women health that you would like to debunk?
First of all, the women have a conception, the society has a conception that periods are very shameful. There is nothing to be shameful about the periods. It's a natural physiological process where the kidneys secrete urine. The same way, the uterus secretes the unwanted outer layer in form of menstrual flow. So there is nothing to be shameful about. There is nothing to be called a taboo about or segregate women who are pregnant, who are menstruating. And the second myth that's very common in India is that mammography causes breast cancer. There is no evidence to show that the mammography is linked to breast cancer. And repeated mammography after 40s does not mean that you are going to have a breast cancer or increase the evidence of incidence of breast cancers. Then there is a myth that breast injuries or wearing very tight bra can cause breast cancer, which is just a myth. There's nothing, no evidence regarding that. Then there is a conception in females that when they are breastfeeding the babies, it avoids pregnancy. There is no foolproof thing that breastfeeding can avoid pregnancy. Because of this, many Indian women, the spacing between the kids are very limited because of.
So my another question is like, what are your thoughts about IPL? Like, does it affect future pregnancy?
IPL we have when we have an unprotected sex or there is a contraception failure. Though it should be taken within 72 hours of unprotected sex, and it can be taken from 72 hours to 150 hours. That is from within 3 days to 5 days. And IPL does not affect any future pregnancies. IPL only affects that particular cycle. If there is ovulation going on in the female body at that time when the IPL is taken, then it delays ovulation. Or if ovulation has already taken place, it delays fertilization. Only in that particular cycle. It will not have any effect on the coming cycles. Though you can very safely take IPL, and there are mild side effects of IPL like any other medication like vomiting, bloating, you're feeling nauseated. That's completely normal. If the symptoms aggravate like any other for any other medication, then you can consult a gynecologist and take expert advice. Or else the IPL are completely safe if taken around within 72 hours, and the longer duration, the chances of getting pregnant will increase.
I have another question, like what are some self-care practices that women incorporate in their daily lives?
There is limited self-care practices which if you can do easily, it will be very beneficial for the woman. First of all, to prioritize ourselves, because if you want to take care of a family, you have to first take care of yourself. So the woman in the family should be healthy in order to the family to be healthy. And next, the woman should get enough sleep of about 8 to 10 hours. Women need more sleep than men to function physically and mentally well. And there are very basic tests that women should get through in as a self-care practices. They should get a pap smear after their 30s for every year. So you can screen the uterine cancers very easily with them. And they should get a mammography after their 40s yearly once. and this should be done very regularly if they have a history of breast cancer, uterine cancer in their family. And women should do regular exercises, at least 30 to 40 minutes per day. Any exercise which you're comfortable in, walking, jogging, swimming, gymming, whatever you're comfortable in, at least 30 to 45 minutes of exercise per day, or at least 1 hour of exercise 3 days a week. So that will be very beneficial for the long-term health, because the woman's body goes through changes in their teens, in their 20s and 30s, again in their 40s of menopause. So this lifestyle changes can help them to have a healthy lifestyle and maintain a good menstrual and overall health for themselves. And there is even a notion that heart diseases are only prevalent in men, but it is not so. In pre-independence era in India, if the 10 patients of heart diseases would come to an hospital, out of that 9 were men and 1 was female. But the ratio is completely changed nowadays. In 2024, the survey which came out, it shows that out of 10 patient heart diseases, the 6 patients were men and 4 of them were female. This is because of many things. The sedentary lifestyle the women are taking today, obesity in females, which is very common, and smoking is also a very shocking and prevalent in females. Mostly the female with the higher socio-economic status, who are into corporate lifestyle, they are very into the smoking ratio is increased in women, and women with lower socio-economic status, the ladies who live in villages, smoking bidi is very common in them. So that also increases the risk of heart diseases. Like smoking has an adverse effect on male health, same way it has an adverse effect on female health. But female are not very, they think that it is a male disease. They can't get heart diseases in females.
So how do you manage both the things, your home and your professional work, like it's great?
It's a little difficult to manage, but it's not impossible. Many women today are working and at home and even working outside. It's a little, you have to adjust your timing. You have to prioritize things and take a schedule for everything. Make a time for your family and your professional life as well. Balance both the things and it can be easily worked out.
So if you go back to the beginning of your journey, what advice would you give to yourself?
Choosing a career which is becoming a doctor is a little different from others, and you have to work hard, you have to try very hard, you have to study when everybody is enjoying their life in their teens or in their 18, 19, the initial ages of life, and you have to keep constantly upgrading yourself, because there are new technologies, new medicine, and if you're willing to give that part professional life importance in your life, you can opt for a doctor, and it is not very difficult. Many people do, and if you have the willpower and if you are ready to give up a few sacrifices in life, you can easily do it. There's nothing big thing about it. It's just a determination. Your power, having a focus and confidence in yourself, it helps you a lot. I did my MBBS in 2009. I completed my MBBS in 2009 from a college in Karnataka, Alamin Medical College. Then after that, I settled my base in Delhi. I did my diploma in emergency medicine and other degrees in Delhi from Apollo. And after that, I have been practicing in Apollo's. And currently, I'm practicing in Sanjeevan Hospital. And I have my 2 clinics where I visit a patient, OPD, I do my OPD. And in between, I've done other specializations as well, so that it can benefit me in my medical education. And
that's it for today's episode. Thanks for joining us. Make sure to subscribe so you don't miss the next conversation. Thank you.